And right now, I'd like to bring out Tom Whalen from Aspirus Health. And Tom's going to tell us a little bit about his experience with the EMC products in the Avamar space. And Tom, why don't you go ahead and join me? We're going to do this fireside style. I left my ascot back in my hotel room, so I hope you don't mind. I'll stay a little formal on this. But Tom, why don't you tell us a little bit about yourself, what you do, and how you're using EMC products for your backup?
I'm Tom Whalen. I'm the team leader for Aspirus, the server and storage infrastructure group. We have 5 hospitals in central Wisconsin and northern Michigan, and about 50 clinics in between all those other locations. And we've used the Avamar networker solution to manage our enterprise backup systems today.
Okay. Now, what got you looking into disk-based backup? How did you kind of arrive at the process where you're even searching for something like that?
Sure. We have been struggling since the implementation of a new hospital clinical system, and we were finding that as our data rates were growing, the backup systems that we had previous to that weren't able to kind of catch up with that process, and was causing a bunch of inefficiencies with the backups being done timely, backups being done at all, and we were just kind of going through this endless struggle to keep those backups running efficiently, and our data rate was growing so much that we couldn't keep up.
Okay, and you did go straight to deduplication. You actually looked at kind of the who's who list of backup software providers out there first, right? So you actually went through a couple iterations. Can you kind of tell us how that went?
The problem we were running into with working with different vendors and different vendors' storage systems is that while each on their own merit may work, it was the working together that they didn't seem to work real well with. So we get a lot of vendors pointing fingers at one another. It was the tape array's fault, or is the backup management software's fault, or is driver incompatibilities, and we were just kind of struggling and working through those issues. At the same time, we still were not getting our backups done. So it was a pretty tough time for us. We were spending more time trying to figure out how the backups would work versus just getting good backups.
Okay, and so you have a really good, strong relationship with your EMC rep. You went to him after this process, and you actually went through a couple years where you're looking at different backup software, and you upgraded the tape library to a newer, better model. But then you went to your EMC representative and you asked him a question. I like the question. What did you ask him?
I asked him to sell me the last backup solution I would ever want to buy, because I was tired of buying them. We just got to a point where we were so frustrated, and we had tried everybody, from tape arrays to different backup software, and we just, we already had a really good relationship with EMC from a storage perspective. We needed a good backup solution, and we knew that we could turn to EMC to help us with that process.
Okay, and how did how did it go when you first were introduced to Avamar? Tell us about the process, the proof of concept, and
sure.
What happened.
We did a single node proof of concept, and it took about an hour or two to install the node. It was actually very easy to install. EMC support came in on site and supported it, and installed it. And the first backup we cut on it was faster than any other backup that we run prior to that by over 2 hours. So we were pretty shocked at that. And after we had gone through the process, the proof of concept for, I think it was 2 or 3 weeks, we found that the backups were getting a little bit better as each backup cycle continued through. And that was because of the way the deduplication process would work with the Avamar storage system versus anything else we'd seen against data sets upwards to terabytes in sizes. And we were pushing our clinical database to it, which is itself a terabyte in size. We were pushing SQL Server information to it just to really stress it hard to see what it looked like in our environment. And running all those backups, we saw our backup windows decrease in hours and hours of time that we'd never saw before. Our worst backup, while we were in the proof of concept, our worst backup was 19 hours for a terabyte of data. With Avamar, the end of the proof of concept, we could do that backup in 4 hours. So we felt that was a pretty amazing result for us.
Okay, fantastic. And then when you moved into production, times got even better from what I understand.
Yeah, we once we moved to production and we moved essentially all of our mission critical data over to the Avamar backup system, our backups run right now roughly 4 hours, 4.5 hours from the 19 hours that we were seeing in the worst case scenario. And some of the backups get done very, very quickly because based on differing change rates and things like that of data sets. Some of the backups are done within minutes versus before they would take an hour or two to get done based on their size. So, and also reduces the quantity of data. For a terabyte of data for our HIS, with the way the deduplication process works with Avamar, we're only sending about 20 gigs of real change data down to the grid night to night. So what that means is that we can do far more backups with less backup space because of the way the deduplication process works. And we found that that was really, really beneficial.
Okay. And you guys do something that's a little bit, interesting and beneficial from the standpoint that not only do you use your data in applications internally, your infrastructure stack is so solid and stable that it's renowned in the area for being one of the best, and you actually sell it out in the marketplace to third parties.
What we do is our healthcare system uses markets our IT department as a selling point to small entrepreneurial-minded physician groups that may not necessarily want to have a direct alignment with the healthcare system, but they want to leverage technologies that a larger healthcare system typically would own. So what we do is we offer our HIS application. It's kind of a SaaS model that we've kind of created on our own, but we use our internal infrastructure to house all of their data, and then we have the ability to protect it, and then they also gain all of the services of our IT department, and that helps not only helps our bottom line as a company, but it also funds our IT investments as well moving forward. So as they purchase and lease those technologies, we take that money and reinvest it into the technology, and it grows our environment.
Okay, and you also mentioned that because of that, the data that you have, the applications that you have, they don't grow in a very predictable pattern. They kind of grow in fits and spurts as things get sold. So
right. So as we grow as a company, we may bring on 10 clinics at one point, and that could dramatically grow data rates. And then, we may not do that for a number of months. So what we see is these really high peaks and valleys when it comes to our data changes. And what we see with, the Avamar grid handles that very, very well. It doesn't seem to react to in any way that would cause us to be concerned with the protection of that data or anything like that.
Okay. And then just one last question. You also had a pretty significant investment in storage used for backup, aside from what you acquired with Avamar. What happened to that?
Well, when we purchased Avamar, we also bought Networker. And what that allows us to do is it allows us to take some of these older legacy capital investments in things like robotic tape arrays, actually a different deduplication, a target-based deduplication system that we were using for some legacy applications. And with Networker, we can bring all those together into that common interface and still retain the use of those technologies. And as we want to expire them and migrate away from them, as we grow our Avamar side, we can still leverage the use of those technologies because they're actually very good machines and they work well in our environment. So Networker gives us the ability to bridge all those technologies together. While it's very easy to send a backup to Avamar through Networker, we can also still cut tape if we need to. We can go to maybe a different deduplication system, an older legacy deduplication for maybe non-mission critical data if we want to. We can also back up our Solera. We have an EMC NAS as well. We can back that up through Avamar and Networker as well. So it gives us a lot of control over our backup environment, which we really didn't have that much in the past.